ما أريد من هذا الشعب إلا أن يزيد في الحمد والشكر إلى الله عز وجل، ويزيد من محبة الوطن، ويزيد من العمل ومضاعفة العمل لما يسعى فيه من خير له وللدولة والأهل. هذا اللي أنا أدوره من الشعب، وربنا إن شاء الله يوفقنا جميعا على ما يحب ويرضى.
Today, we are honored to host Dr. Ravi Khamar, the Managing Director of Movement on a Physiotherapy Clinic that gives you a comprehensive treatment that are personalized for your specific needs, focusing on holistic recovery with their experienced team. They aim to improve mobility, reduce pain, and enhance overall well-being. So, to know more, stay tuned.
زايد أسسها واليوثن وراها، داروا على الدانات 7 أبد. إلا دار زايد لا تقرب حماها، لا تقرب منازلها إلا محب.
So first of all, I would like to really, from bottom of my heart, would like to express my sincere gratitude to the rulers of UAE, Dubai.
Welcome, dear audience, to your favorite program, Pairs of Union, which highlight, shed light, and focus on the remarkable journeys of the inspiring individuals here inside the UAE. And today, from Dubai, we are shedding the light on a new successful story with Dr. Ravi Khamar, the Managing Director, the Physical Therapist of Movement on Physiotherapy Clinic. Let me start the episode by welcoming our guest, Dr. Ravi. Hello, Doctor.
How are you? I'm absolutely fine. Thank you so much for having me.
Thank you, Doctor. Today, Doctor, we'll talk in many fields. But first of all, can you tell us about yourself, your background, and the significant milestones you've achieved to present you to all the audience?
So first of all, thank you so much for giving me this opportunity to speak in front of your audience. So yes. I first of all say hello to everyone. Okay. So myself, Dr. Ravi Khamar. And basically, I'm a physical therapist by profession, but at the same time, I have done my super specializations in the neck and the back. So any people, they actually suffer with a lot of back pain, neck pain, and they're supposed to go for surgeries or something like that. That is my specialty to treat, and I have treated thousands of cases successfully. They lose the hope and alhamdulillah recover also. So that is what I do. And basically that is my specialty.
Now, Doctor, can you tell us about the challenges you faced during your journey and how did you overcome, how did you address these challenges?
So if you ask me about challenges, okay, there are lots of challenges in my journey are there. So if I talking about my early days in my career, what made me to become only physical therapist, that is my family incidents I want to highlight. My grandfather, my mom's father, got paralysis. And he suffered for 5 years due to the lack of proper physiotherapy treatment. And when he was died, at the same time I was writing the exam for that, so I could not even go for a funeral. And on the same time I decided to become the physical therapist, and I will save a lot of lives, because he's the pillar of my family, and we lost him because of lack of proper physical therapy treatment. And that is the day I decided to become a physical therapist. That is the one thing. And another thing hard was like, even it was my exam day, so he died there and there is my exam time. So if I go there, I'm not able to clear the exam, and I have to waste my another 1 year. So I decided to give the exam, and then I clear it, and then I decided to become a physical.
And it is hard to choose one of them.
Was very hard time, because I know when I was writing the exam, it's kind of emotion, but somehow I clear that phase. The second phase, I'll tell you, like after,
may his soul rest in peace.
Yeah. So and the next thing, what I just tell you, like when I become a doctor, I realize, okay, in this field people are not much aware about it. So I did my first job, okay, that if I tell you, you will laugh. That is, I had done at the moment, if you're counting right now, it is just 10 years back, around something like that. There is 100 dirham per month was my salary. As become a doctor. That was the very struggling phase. I realized people are not aware about all these things. And from there, okay, I started, I have the guts and I have the feeling I can really contribute with my skills with the physiotherapy. That is the 2 challenge. And the third challenge, that is the twisting point of my life. I supposed to plan to settle down in US. I just prepare for the exam. I appear for 2 to 3 times for the examinations, but somehow like some hurdle has come and it could not go right way. And then finally, the thing is that when I supposed to give my last thing to settle down, some government rules and everything has been changed. And then I decided to shift my focus from US, America to Dubai side. And that is how I just choose to come to Dubai to becoming a practitioner as a physical therapist. Then I come to Dubai, then I started my journey in Dubai. So this kind of the 3 kind of the stories, that is kind of twisting point of my life. And when I come to Dubai, there are a lot of stories.
Yes, and it's a sensitive story. It's not only according on work, no.
Absolutely, yes.
And of course, we need, or we should, to face challenges to succeed, doctor.
So that is the very, like, I lose the hope. Like, my dream was to work as a physical therapist in in America, because as a physical therapist, there is a hub for all the physical therapists. But destiny has written something else for me. So we have to trust destiny. And I just grasped that opportunity and I came to Dubai.
And we are proud of you today.
Thank you. So almost now in Dubai, now I can say like 6-7 years has been spent. And now, alhamdulillah, with the God's grace, now I have my own clinic.
Doctor, now who have been your biggest supporters, who have been your biggest mentors throughout your, or throughout this grateful journey?
So there are so many people, but if I'm starting with my family in early stages, if I'm my parents and my elder brother, they are my supporting system, initial days of my life. And once I get married, okay, of course, my better half, my wife, was always a support at pillar. Whenever I'm the stress, whenever I'm feeling little down, I'm actually giving up. She is motivating me like, no, why you started this thing or something. So my family, of course, they are great support system. And there are so many mentors in my life. There are so many names, if I had few. So they also help me by watching them to never lose your hope and always focus on your vision. What is the vision you have? So there are so many people are there, but if I name it, some of them, I might be, you not understand, but there are 3-4 person. That is kind of my ideal in my life.
Doctor, can you tell us the story, the vision behind founding Movement On?
So there is interesting part I want to address here. I have been practicing UAE since long time.
Yes.
And what I realized, the people here, the system, all medical system here, the people are not still aware about the physical therapies, what the physical therapy actually can help the patients.
Yes.
And I've seen there is an insurance system, there are so many things. I have been practicing hospitals, clinics, and all this stuff. And I realized there is a really need for specialized physical therapy, separate clinic.
Yes.
If you find in UAE, very rarely you find the individual physical therapy clinic.
Right.
Mostly you will find with the polyclinic, there is one room they allotted, or might be big hospital, they have a department.
Yes.
But in that one, what is happening, the standard of the care, what they are providing, okay, what I've seen in US is drastically different. And 80% of the people, okay, they are getting physiotherapy, but they're actually not getting the value and the recovery out of that one.
Yes.
So I decided I want to create change in that one. So any person who's actually looking for the right way of proper physiotherapy for his recovery,
Yes.
okay, so the first name comes to his mind is Movement On. So that is my vision. I started individual clinic, and my vision is very clear. I want to totally focus not in only business perspective, but I want to really add the value to my client and the patient. So I want to create, any person is suffering
Yes.
with this one, they lose the hope, they remember this name, okay, Movement On Physiotherapy is there to help them.
Doctor, what are some of the biggest challenges you faced in the physical therapist industry?
If I'm talking about country-wise, okay, so back in my home country, India, first of all, people are not aware about that one, okay, at all, like what is physiotherapy. So it's sometimes very hard to make them to convince to, even they have a problem we can solve, they're not understanding.
Yes.
So that is the awareness, lack of awareness, that is the first point. Now, if I'm talking about UAE, mashallah, UAE is far better than that, no doubt about it. But still, people are not really aware, like the developed country like UK, US, Australia, because they are actually in very advanced level of physical therapy. So as I've been in US, I want to bring that here. So if I'm talking about a UAE wise also, still the 50 to 60% of the people, they are not aware about what the problem the physiotherapists are able to treat, and they are taking unnecessary medications, going for surgeries, and ultimately not getting any value and no recovery. So that is the one challenge, to make the patient to educate.
Yes.
Okay, another challenge, like insurance system. So the thing is that in insurance wise, mostly if you go to UAE, like suppose you want to go for a treatment, okay,
Yes.
so you mostly call and go this clinic, okay, whether my insurance is covered or not covered,
Yes.
right? But obvious, okay, because the cost of here the medical is expensive.
Right.
So the thing is that in insurance wise, the system is like that. If you need to take a physiotherapy with me,
Yes.
okay, the system is like you have to first go to the doctor. You need to just take a referral and everything, and then if he feels you need physiotherapy, then he refer back to me.
Yes.
Then only I can take the treatment under the insurance. So I have seen with my client or something, first of all, this process is actually adding a lot of pain to the patient. Why? Because he's wasting a time for a patient. At the same time, in physiotherapy itself, when we study in the physiotherapy in detail, there is a physical examinations part is there.
Yes.
So
Right.
actually the physiotherapy are eligible and they are competent to check patients X-ray, MRI, and also with physical examination, they can identify what is the diagnosis and they can treat that one. So because of just insurance system, we cannot tell patient to directly to come here and take a treatment. So this is the biggest hurdle right now, I feel. I don't know with your TV channel or something, if someone is watching or something, if I can tell them, okay, this is the system, and if the higher authority of ministry or something, they are listening, I have one bigger plan, okay, to help the people to prevent unnecessary surgeries and medication or something like that, and with the help of proper physiotherapy they can recover also. So if someone is listening and they are ready to do the meeting with me, I'm more than happy to suggest some of the suggestions for this process, okay, and we can help the people directly without unnecessarily the hurdles. Okay, like suppose I'll give you the example, you are having a severe back pain, okay, you have an insurance is covered with me. If I'll tell you to go to another doctor, okay, for a checkup, and then only I can apply your insurance, so it takes almost around 1 week time. Now in the pain, you can able to tolerate 1 week pain, and if you are starting without insurance, you have to pay from your side. So you understand the practical problem on the ground level, what is happening. Okay, now other hospitals, they have their doctors inside, but still it takes at least 2 to 3 days to start a treatment. But instead of that one, if we are making some system that way, if you have a problem, we assess, we can directly apply and your insurance is covered, we can start the treatment immediately, you don't have to suffer.
Right. It's a great decision.
Yes, so there are
Better for the people, for the patients.
yeah, but I'm not against that one. There is some protocol they are following. I respect that one. But in that one, we can just modify some of the things just to help of the, because whoever made, I'm no one to tell. They have decided and they have some plans. That's what they are making. But no, everything like have some changes. There is some small improvement.
Some of them.
Yes. So we can to help the people directly assess the physical
Make it
therapy.
easy for them.
Exactly.
Doctor, now what are the key accomplishments? What are the key achievements you are most proud of at Movement On?
So individually, my first actually I can say the milestone, I want to have my own setup before the age of 35. Yes. So I achieved that one. That's the first thing. And that is also out of my home country. That is second. And apart from that, in my field, I have received so many recognitions with the God grace UAE. Yes. I definitely thanks UAE government and all the people who are sitting there. They are tremendous support system who are doing the good work. So I received so many awards, recognition from so many government authorities as well. And I'm the regular guest speaker for Deira, for all the employee for their back pain prevention program. So, and I received the awards also, one of the finest physiotherapists in Dubai from Sports Authority. And also I received the award as one of the best physical therapists in entire Middle East. So these are some of the biggest achievement I can tell for my personal self. So that
for more and more awards, for more and more achievements, Doctor. Doctor, now what are the future plans? Are you planning to enter into new markets other than UAE?
So first of all, my vision for Movement On is very clear. I want to help the people, and if they have some issue, my clinic should be in the radius of 10 kilometers.
Yes.
That is my planning. So I want to expand the practice first in UAE, and I want to create the standard like in a phone.
Yes.
There is a standard iPhone. Yes. Okay, no, like if you prefer phone, you always think about Apple. Okay, so in terms of physiotherapy, it's Movement On. So this is what I want to create. And suppose you have some issue, you have that faith. Okay, now you use the iPhone, you have faith, like no, there are so many things, it will be very easy. So once any patient comes to the Movement On physiotherapy clinic, and any physiotherapist, they've seen us, including me or anyone, I want to create that standard. They get the right care on the right pricing, with the right time, with the right genuine opinion. That is my vision for my clinic. And I want to definitely expand first in UAE and Dubai. Then we have the plans to do for international.
International.
Yes.
Abu Dhabi.
First UAE, so definitely Abu Dhabi, Ajman, Sharjah, Dubai. Okay. Then we are planning all Emirates.
And after Emirates, what is the first destination? Can we have
At the moment, I'm in dilemma to choose the international destinations, either to go expand in the Gulf region or I go to European Union or something like that, because still in Europe, I've seen so many countries are there. The standard of physiotherapy is not good.
So Europe, not Middle East after...
Yeah, that's what I'm telling. Like now I'm little bit dilemma, either in a Gulf region or either in a Europe or something. Okay. Not initially to go in the developed or underdeveloped nations.
So, Doctor, now can you tell us how the UAE governments, how the UAE environment supported for this grateful growth?
So, first of all, here I would like to take a little bit more time, because I, from bottom of my heart, I really want to thank the who all are like in the management level or the government level. Yes. Our definitely all the sheikhs and everyone, their environment, what they have built up for a business or something is really amazing. It's really safe, and the standard of procedure what they are following is good. So I must say it's a little bit hectic sometimes, but it's overall good for everyone. Okay, so I thank all the government people who are making all the rules and everything. And at the same time, my also vision and idea is there. Like if I get the chance or opportunity to sit with some of the ministry people or some of the DHA people who are making the rules and policies, I want to take the UAE standard okay, hub for a physical therapy in the Middle East. Like if you ask anyone for a medical treatment, they usually prefer to go to US in the world. Why like that? Because there is something is there in the system. So I also want to create that system in terms of rehab and physical therapy, because if you see surrounding Dubai or UAE, all our countries are there, but standard of the living, practice and infrastructure, we have best in Dubai and UAE.
Yes.
So why not take this opportunity, okay, to develop the medical tourism in terms of physiotherapy or some of medical. So I have a lot of suggestions for that. So I already have some suggestion for rehab first and the physiotherapy, and also for medical industry as well.
Doctor, what is your own concept of success?
Okay, first of all, if you ask me, okay, don't run for a success. Believe me, like you try to make yourself very competent about something that no one can able to copy that one.
Yes.
That's the first thing.
Right.
And try to provide that in that way to help the community and the people. So you don't have to run for a success. People will come to you for your things. And if you ask me honestly, when I'm able to recover one patient, he's under the pain for 5 years, and I'm able to put the value in his life with my skills, I don't think so like that satisfactions is bigger than any money or something. So I'm not telling there is no money involved with that, definitely. But the thing is that my definition, value addition to the people with your skills, that is the biggest success. Don't run for a success. If you're capable of doing something, just try to develop something at a scalable level that you can reach to help more people. And for that only I'm conducting my back pain seminars. This is kind of I feel good when I'm helping like 500 audience with my knowledge of 10 years of experience treating thousands of patients to prevent them early in this life, like to prevent a back pain or something. That is one of the thing like I consider as a success, and to help people with my skills. That is my definition of the success.
This should be the vision of success for doctors.
Yes, that is my vision. And if you ask any of my patient, you will find this is always there. Like, no, if I'll be straightforward, if you don't require a treatment, okay, I will tell straightforward. And if I'll feel you require a treatment, I will tell you also the straightforward. Okay, because I'm here to treat, not to please. Okay, so if you don't have an issue or something, I don't want to treat you. You just go and just do that. That's more than enough. So I like to be transparent, honest and genuine for all my clients and the patients.
Doctor, today, what's your advice for the entrepreneurs, for the new generation are looking to enter the medical field?
So first of all, as a medical practitioner or as a doctor, you have really good responsibility to help the people with their help. So I consider this is like my privilege that God has given me this opportunity, and I would like to give my basic advice. Look at the patients with empathy and try to help them in a genuine way. And if you go that way, if you have that vision, definitely you don't have to go for anyone's advice. The people will come to you. So that is my simple and rule and my advice to all the people or the doctors who's entering in the field. Just become a good doctor and try to help genuinely to your patient.
And finally, what's your message for the UAE rulers and governments?
So first of all, I would like to really from bottom of my heart would like to express my sincere gratitude to the rulers of UAE, Dubai, because we are really fortunate to have very safe hands, and what the rulers are doing their amazing work, and with that help only we are able to have sincere safety. If you ask about the infrastructure, if you ask about other business rules, and especially if as a medical practitioner, whatever the rules and regulation they had made for sincere safety of the patient and the doctors, they are actually mind-blowing and amazing. So I would like to again sincere my gratitude and thankful message for all the rulers of UAE, Dubai. They are doing amazing work. And I would like to also if in any case, if I have opportunity to be part of any kind of the health related things to help the UAE government or something, okay, I would be it's my pleasure and it is my privilege to be part of that, any kind of the occasion, the event.
Thank you too, Doctor, for this amazing episode. Thank you for all the details. Thank you for all the information.
Thank you so much, Miss, for having me once again.
Dear audience, we reach the end of our episode. Watch us next week and goodbye.